Dr. Biernesser is a behavioral health scientist and licensed clinical social worker, currently appointed as assistant professor and director of digital interventions within the Department of Psychiatry at the University of Pittsburgh. Her research interests rest in three areas: adolescent suicide prevention, the study of social media experiences, and the development and testing of digital interventions. She examines ways to understand and mitigate the impact of negative social media experiences, particularly focusing on online victimization, given its linkage to suicide risk among youth. She is passionate about developing digital interventions to improve the mental health of adolescents from underserved and minoritized communities, particularly the LGBTQ plus youth and youth of color. She and her team have been integral to the development, testing, and implementation of a range of digital tools from smartphone apps, texting programs, chatbots, and more through funding received from the National Institute of Mental Health and the American Foundation of Suicide Prevention. So I'm going to turn it over to you, Dr. Biernesser.
Wonderful. Thank you so much for the introduction. I really appreciate it. Work on sharing now. Okay, can you all see that okay?
Yes, it looks good.
Thank you. Okay, so I will be talking with you all today about different ways we can think about helping youth to flourish. And I really agreed with what Meg said in the introduction, that I think suicide prevention is one of the more hopeful things that we can actually do, and to helping to find ways that they can flourish, and in fostering positivity and so forth. And that's, what I'd like to talk about today, are some ways that we can do that together, particularly in thinking about online environments and suicide prevention among LGBTQ plus youth. But before getting into that, I wanted to introduce myself a bit beyond that introduction that you heard. So I'm a clinical researcher at the University of Pittsburgh. I'm trained in behavioral health sciences and as a clinical social worker. And so I do work around suicide prevention among youth from underserved populations within mental health care. So those that don't have the same access, aren't receiving treatment at the same rates as other groups, including LGBT youth and youth of color. I do a lot of work in thinking about ways that social media can either positively or negatively contribute to mental health among youth, and thinking about ways that we can leverage technology to try to make some important gains in terms of mental health and suicide prevention. Who I also am, though, is a mom of two wonderful kids. And I think that really inspires a lot of the work that I do, and really wanting to make a difference for them, and having a better world as they move throughout their life. I'm someone who came of age when social media was really at its infancy. And so, I've seen what it was like when there wasn't social media and when it first started. And maybe some of you on the call today have seen that too, and really kind of watched it change over the course of time. And because of that, it just makes it something it's very interesting to me. I'm a person who knows what it's like to not get services when they're needed, and that really inspires the interest in working with youth who are from different underserved populations and wanting to make a change in that area. And I'm also a person with lived experience in my family, and so that really motivates a lot of this too, because for many that I talk to, especially on AFSP related events, it's personal, and it's something that you care about deeply, and that I do too. I do other work beyond what I'll be talking about today. I list my website at the bottom there, so if you're interested, you're welcome to check that out too. But for now, I will move into the agenda. So I'll really be talking on three topics. The first is really giving an overview of thinking about LGBTQ teens, social media, and also mental health and suicide risk. Secondly, I'll give you a little bit of an overview of some of the research that we've been doing in this area that was funded by AFSP, and also thinking about some strategies and resources, some take-home pieces that if you're looking for some insights or different connections and resources that you can walk away with from this, they'll really be packed in there. But first, I'm going to go through the section on LGBTQ teens, social media, mental health, and suicide risk. So I really wanted to center this conversation and thinking about the national conversation that we've been having about social media and its influence on adolescent mental health. As we've all seen from the media and from many different places, it's a topic that's raised attention from families to national leaders in health and education. And there's some of the organizations and governmental agencies that have released policy and position statements to this on the right. So it's the U.S. Surgeon General, American Academy of Pediatrics, and others. And really across, if you look across those different policy and position statements they've released, there's this interest in really finding ways to protect our youth who are most vulnerable. Vulnerable in terms of mental health risks coming into using social media, and also, again, that focus on youth from underserved populations. Then if we think about LGBTQ youth, especially, this is a slide that can give you some examples of the differences that we see among LGBTQ plus youth and then all youth across mental health concerns like symptoms of anxiety, symptoms of depression, as well as seriously considering suicide attempts and attempted suicide. And so I'm pulling from different national surveys here, the Teen National Health Survey, Youth Risk Behavior Survey, and the Trevor Project survey that is for LGBTQ plus youth. And I think the takeaway that you can see here is that the rates across the board are really higher among LGBTQ plus youth. As someone who works in the suicide prevention space, I think a lot about this difference we see in suicidal thoughts. They're really about double in LGBT youth, and they're about 1.5 times in terms of attempted suicide in LGBT youth versus not. So there's high rates in this area, and some things that aren't pictured here, high rates of violence, discrimination, adversity, really across the board. And these are experiences that aren't just occurring in person in their everyday lives, they're happening also online too. And that's something we can think about and talk about too. And there's also protective spaces, both in person and online too. When we think about youth, LGBT youth in the context of social media, so they use it a lot. There was a survey that showed LGBT youth are using social media at around 5 hours per day. And if you look at surveys outside of non-LGBT youth, it's more like 45 minutes to an hour per day. So there's a big just difference there in terms of this population. And in some ways, we might be having that concern about exposure to different negative experiences, that some of us may be aware of things that come online. But for a lot of times, that could also be because it's an affirming space. And that might be why there's such a big difference here. So at the bottom there, you're seeing a chart from the Trevor Project that is showing affirming spaces among LGBTQ young people, with the majority of them, over 2/3 of them, finding those affirming spaces online, and considerably less than other spaces, especially within their home, their school, and also within their community. And so when we think about that number being higher, I think that the context of around this also being a space to find affirmation is also useful to consider. We can also consider thinking about social media with balance. So I mentioned before, there's a lot of widespread attention to this topic, and a lot of it, especially if you look to the media, is fairly starkly negative. And if we look into the research, it really suggests that we need to think about this topic with balance, that there are both risks and protective factors, and we have to equally recognize both. I love this figure that's from Jessica Hamilton, who's another suicide prevention researcher, that really says, when we're thinking about each individual's teen's youth, we have to think about it in context. So maybe there's an LGBTQ plus teen that's going on some social media to really find that kind of community connection, to find ways to explore different aspects of their identity, which is a thing that all teens do, but to do it in a way for them that feels safer, to build social relationships. On the other hand, there might be some risks. Maybe they're experiencing bullying, discrimination. Maybe going on social media is disrupting some things that they're doing in person, like interacting with other people in their everyday lives. And so we have to think about these things in balance and finding the right balance for each individual teen. So I'm going to talk a little bit more about risk protective factors, starting with risk factors. And this is a very high level summary of some of the risk factors we know related to social media use in teens broadly. And I put the ones that have a stronger body of evidence behind them in that darker orange color. So it's things like being exposed to negative or harmful content online, This could be things like being exposed to content that would be promoting of things like self-injury or violence, problematic use. So this isn't just using social media a lot. It goes a bit further than that in saying this social media use impairs aspects of daily life. So using it in place of doing homework or sleeping or exercising. And sleep is a really big one because it's sleep disruption is so meaningful in terms of a mental health risk, where on the other side of that, healthy sleep is such a strong protective factor. And online victimization stands as the top there. And that is one that is specifically important to LGBT youth. So I'll speak about that a little bit more. This can include hurtful comments, images, behaviors on online spaces. So I think of this largely as online bullying, harassment, and discrimination. There, there are higher rates of social media use among LGBTQ youth, as I mentioned before, and that's thought to contribute to some added exposure to a lot of the content in this area. So rejection, bullying, harassment, discrimination. And in some cases, these might be things that these teens are experiencing in person, and they're also experiencing them in their online lives as an extension of that. In other cases, it can be entirely new outside of in-person lives. LGBT youth experience about 3 times the rate of online victimization compared to non-LGBT youth. They're thought to be the group that is more impacted by this topic than any other. And I wanted to share a little bit about what we hear directly from teens. LGBT teens are experiencing this. So this was from a study that we did with 20 youth, and we asked, these were all LGBT teens with lifetime history of suicidal thoughts and behavior. And we want to understand, how do they experience online victimization? And so all of them said that they experienced verbal harassment in different ways. Some of them said it was directly experiencing slurs, in which it was pretty clear what the intention behind that was, and it was a negative one. In other cases, it was indirect. It was a lot less clear in what was actually meant. With one teen saying there were kind of vague postings. So like when I came out as non-binary, there was only one person who really came up to me and was talking to me about stuff in a hateful way. And they went on to say, and there were a lot of other people who said stuff in this really vague way that I kind of had to interpret what they meant, but either way, it left me feeling really kind of down after hearing that. Some of them experience actual physical threats. There's a teen here who is saying that there were threats to her dad's temple and her school related to a comment like, "You're not a true Jewish space if you allow queer people," and feeling like that one was especially difficult to hear. Having that kind of physical threat, especially in an environment that this person holds dear, was really challenging. And some of them also talked about sexual harassment. 3 of them, they were all youth who identified as female, talking about how they were on this Discord channel where a lot of them would share messages back and forth about being targeted on comments from typically other males, sometimes those who are adults, that were inappropriate in nature. So how and why this matters. These experiences and these kind of stressors that can exist online, for some youth can be chronic. They, in terms of their impact on their life, they have this kind of unique contribution to mental health that is, different maybe from other stressors or things that are happening in their life that has been linked to suicidal behavior. It really stands out, this topic, online victimization, even among other social media related risk factors that I shared before, and contributing to a lot of outcomes related to suicidal thoughts and behavior. But I also wanted to talk about protective factors, again, acknowledging that for LGBTQ youth, social media can be a protective space in a lot of ways. And so this is, again, a very high-level summary of what we know in terms of protective factors in this space, with the 2 that have the strongest evidence being social support and social connectedness. And there's a lot of different ones, though, here, too, of finding a sense of belonging with other like-minded people, getting engaged socially, having a lot of positive exposure to positive content that's creative or just funny. There's a lot of potential for positivity here. And what we hear of protective factors, particularly within LGBTQ plus youth, they'll talk about social connection. So having an avenue that they can really connect with other people around their age, it can make them feel less isolated in the world. If you think of particularly if there's a teen who's from a community where they don't have that same kind of connection in their home, in their school, etc., they can find that online. It can really reduce that feeling of loneliness or feeling isolated. Um, Also, identity development. So when we can create, kind of curate an online environment where we have these protective spaces. And what I mean by that is really having a closed group with trusted other people, especially. It can create the safe environment to really foster identity development in a helpful way, where it may not have the same level of fear or concerns around stigma that one may have in person. And there's also a lot of different ways when you learn how to use the technological filters and so forth online, you can really manage disclosures of feeling like this is not an environment that I want to be out, or for them to know different aspects of that. You can block or use filters to really try to reduce that. It is a skill, though, that needs to be learned, and to really think about that mindfully as well, to make sure that we have that safe environment and entering into it. And also social support. So there's some ways that social media can extend support that people may even experience with other friends that they have in person, or in other space, or even with new people, and giving, receiving helpful information, discussing information just with other like-minded peers. And so these are some examples. This is from a study from Berger and colleagues that really gave some examples of some of these protective factors. So in relation to finding connection with like-minded other people, one 16-year-old trans boy said, it's sort of a little hub where you can go to get away from people who are intolerant. And then thinking of social media really as a safe space for information seeking. There's a 17-year-old female who said, I come from a pretty conservative family, and I would not feel comfortable asking questions about certain things. With the implication of things that being, there's some information that I really need, and I'm not comfortable talking about within my family, but sometimes I can find in hopefully some vetted evidence-based spaces to get information that I actually really need. There's opportunities for identity exploration, with one 16-year-old female saying, without social media, I probably would not be so open. Social media means that you're open to a whole lot of conversations that you weren't going to have face to face. Also, really thinking about how this can open our eyes and gain perspectives to people from different areas, maybe different countries, even closely, than we might have within our day-to-day lives. And we have to, monitor some of those things, but also increasing that awareness perspective can be really helpful. So how and why this matters. When we think of these topics, social support, connectedness, positive identity formation, these are really across the board looked at as protective factors in terms of youth mental health and suicide risk. There's been about 500 studies now that have showed online social support can be a protective factor for mental health, as it relates in it specifically within LGBTQ plus youth. It is related to reduced depression and feelings of loneliness. And just in general, we know that LGBTQ affirming spaces, whether they be online or in person, can really promote feeling included, in having in that kind of inclusivity, feeling like you belong, feeling like there are other people out there in the world who understand you, can be associated with lower feelings of suicidal thoughts and behavior. Also thinking about youth who are LGBTQ plus, but also hold other marginalized identities. They may experience greater exposure to risk through social media, but at the same time, they may have greater opportunities for benefits from it as well. So first talking about in the risk space, this was from the Trevor Project survey in 2023, when they were looking at rates of LGBT young people who felt discriminated against in the past year on the basis of their sexual orientation or a gender identity. And these are youth within different racial or ethnic groups. And I circled and kind of highlighted Native/Indigenous there to show they're the group who is experiencing the most kind of discrimination across these different groups. They're also consistently the racial group that has the highest rates of suicidal behavior, which is meaningful to think about this in terms of how youth from different identities can experience risk. And at the same, and this is a reflection on how it can also be an opportunity, serve opportunities for benefits. This is showing rates of mental health indicators among LGBT youth of color who feel safe and understood in at least one online space. With that group feeling safe and understood in at least one online space being in orange, and the kind of greenish color being those who don't feel that way. So those with orange have lower reported rates of anxiety and also attempted suicide in the past year, showing that online support really does matter. So moving on from that, I'm going to tell you a little bit about some of our research within this area. So I'm going to tell you a little bit about the team leading into this that importantly contributed to all of this work. So we have had grant support for this work from NIMH, but also the American Foundation for Suicide Prevention and the Your Mom Cares Foundation. It includes Tina Goldstein, who's been my primary mentor in all of this, David Brent as well as a lot of other people that have contributed to making this happen beyond just me. And I'll tell you in particular about the ACT study, which was an early career award funded by the American Foundation for Suicide Prevention. So we had a study that really focused on designing and testing a suicide prevention intervention for LGBTQ plus adolescents experiencing online victimization. And so this study started with qualitative interviews. And I will tell you a little bit about what we heard from the LGBT teens that we talked to, parents, and professionals. And I think I forgot to share with sound, so I'm going to unshare and reshare just for a quick second. Sorry about that. Okay. Let me know if you all can hear this.
It's like anytime you post something about being gay and it being a gay safe space, that's when homophobic and transphobic people decide to take it over and spew hate.
Why does simply existing make me a target of hate?
I felt really alone and really just sad.
Sometimes I felt like the only way to get it to stop would be if I just ended it all.
An app would help a lot. People could go on there and be like, this just happened, and get support immediately. They could go and feel safer. I wish I had that when I was bullied. I want to feel accepted.
Understood.
Respected.
I want to feel safe to be me.
So what you just heard were some of the quotes that came from our qualitative interviews that we had voice actors read that really represent a lot of the themes that came from that. The teens that we talked to were really aware of a lot of different online victimization experiences that they either had or other LGBTQ teens in their social networks that had. They were really aware that it was impacting their mental health and how commonplace it was. Some of them talked about experiencing suicidal thoughts right after that, or how it could contribute to with other life stressors in their life toward that over time. And they really wanted something that could be helpful in the moment when that was happening, and thought that a technology-based intervention could help. What we heard from parents is that I feel like I'm running into a fire blind. I feel powerless. It was a lot of them talking about how the environment that they grew up in looks really different than the current environment with how social media is. Maybe they didn't have it as kids and so forth. And they really needed more education awareness to really be able to help their child at a vulnerable time. We heard from mental health providers that felt like the services in this area are really a blank slate. There weren't really specific treatments that exist really around this or the topic of social media mental health a bit more broadly. They really wanted more resources to add to their toolbox to give youth the support that they really need. And we heard from those in schools. They said it happens constantly and it's difficult to address. A lot of the administrators we talked to mentioning how hard it is to try to address this topic if online victimization didn't relate to school, didn't happen on school grounds. Yet they had these kids there in front of them having a difficult time and they really wanted to be able to help. They talked about how many kids are suffering in silence. And this is really consistent with national surveys that have shown about 18% of teens actually tell an adult in their life that they're experiencing it. So the land share never tell anyone, with silence in this space being a really big issue. And they said sometimes we're finding out years later after they've sustained abuse over time, really saying, I want to know earlier. I want to be able to prevent mental health consequences before they happen.
It's like
we also talked with them about what kind of intervention would be helpful in this space. And so they said what they recommended to us was a text message intervention. For a lot of teens, they said a tech-based intervention would be helpful to them to kind of get out some of their thoughts and concerns that they had about reaching out before they actually did so. It gave them kind of that in-between step. They like the idea of texting because it's widely accessible, even without smartphones. And it's a space that felt a little bit separate from where online victimization commonly occurs, which is on social media. So you can turn off the social media apps on your phone while still keeping texting open. And they liked the idea of some of it being automated information, meaning that you can have some educational information, steps about how to use a specific coping skill that's kind of pre-scripted, but they also really needed to talk to someone in person. So in some ways, it needed to be a tech-based intervention that got youth off their phones and helped to facilitate that. They also talked about different priorities for what Flourish's content should be and how it should function. So a lot of the LGBTQ teens that we talked to mentioned that it should really feel like a safe space that is accepting and private. And that was actually also echoed by a lot of the parents and providers talking about how it needed to be this confidential space. And they really only found out when there were safety concerns, recognizing the teens need autonomy and to be able to manage things on their own unless there's that safety risk. Secondly, they really wanted coping skills that can be used in moments after online victimization. And that's really consistent with the research in this space too, that shows right after that happens, stress can really increase, and intervening on that stress is really important for reducing suicide risk. They wanted educational resources to help in response to online victimization. In particular, talking about how, after this happens, it's not really always clear what to do. Do I report it? But then how helpful is that really? Will I even know if they did anything about it? I want to go and talk to my parent, but will they understand? And also it relates to maybe my LGBTQ identity, and maybe they're not out yet. There's some concerns around that. So really helping with problem solving, what to do in the moment. And then lastly, around incorporating strategies to increase social support and help seeking, acknowledging that those are not always happening in the space, but they're really important to occur. So then we moved into co-designing an intervention with youth. And what I mean by co-design is that we really worked with you throughout every piece of it, iteratively, over the course of time, and really wanted to get their insights on all aspects of it. And I won't go into the details, but I'll give you one little highlight example of what that looked like. So we did an activity called storyboarding. And this kind of looks like what you're seeing on the screen here, almost kind of like a comic strip, where you're mapping out frame by frame exactly what this intervention would look like. So we had teens break into small groups and we gave them a scenario like, you are a teen who just experienced online victimization. You're coming to this texting program looking for help and support. And so within this specific small group, they imagined that you would begin by entering start into texting that to a certain phone number associated with the intervention. And it would respond by saying what happened. So they didn't want it to just jump into offering immediate advice, but to sit back and listen and understand the context a little bit first. It would then ask, what's your goal for reaching out today? So teens really wanted maximal choice in understanding what their goal was really in that moment. And then when would you like us to check back in? With the idea that teens really wanted this to be a texting program that had a memory. It remembered the last conversation and would check back in. And I won't go through the rest of these panels here, but you can see some ideas of how their voice really came through. And we really used all of this in designing what the intervention ended up looking like, Flourish. And I'll show you that next. So Flourish ended up being a texting and also a web-based intervention. We added the web piece for even more accessibility, and it was designed to connect with school and mental health services. This is an example of what it looks like. So it really begins with this friendly character at the top, Sprout. And Sprout's meant to be kind of a positive refrain that is a counterbalance to some of the negativity they're experiencing. It checks in with them. You enter a PIN code for security. It has some positivity that it really gives positivity really throughout. And then it says, do you have time to answer some questions? So that's that stepping back and understanding a little bit first before jumping in. And after that, they go to a main menu where it really teens can choose the kind of help and support that they really want in that moment, either in our texting program or the accompanying website. So the menu there directs to different content focused on reaching out for help and support. And if they're not quite ready for that, addresses barriers in that space. There's a library of digital coping skills to really help reduce and tolerate distress. There's some educational information on social media and how to really problem solve in that moment and figure out what to do. And then an accompanying website that really extends a lot of the information that's available on the Flourish texting program. And you can see that website here. So if you look up at the top where it has the different tabs, the coping skills section really aligns with the coping skills on Flourish. The resources section aligns with that psychoeducation piece around problem solving, what to do on social media. The stories piece relates to that help seeking part of it. There's a lot of stories on there that are from the lived experience of teens that describe how they actually really dealt with online victimization in a way that was helpful. So it mirrors positive coping. And on the lower right there, you can see there's a little chat box that opens up. So teens can actually directly connect with the texting program on the web as well. All of the content is there on the web. They can connect just via their email, which allows a phodeless option. And that's helpful for teens who, maybe can't use social media while they're at school, their phone was taken away by parents, or just they lost their phone currently. So we did something to test the intervention called usability testing. And what I mean by that is we talked with 20 youth who had never seen it before. We showed them Flourish, and then we asked them, is this useful to you? And do you think it's helpful? And the scores from that really on this one scale really ranged between 85 and 91, which were in the excellent range for what we're framing as usability is in around usefulness and helpfulness. And when we asked them open questions about their team's experience with it, they said it was positive, it had a caring tone, it was easy to understand, well organized, and had content that was meaningful to them. And I really attribute that to the youth voice that we had all the way along. And so lastly, in the study, we did an open trial. So this was with LGBTQ adolescents ages 12 to 17 who had recently experienced online victimization and either suicidal thoughts or behavior. They were asked to use Flourish for 4 weeks, and then we followed them for 12 weeks to understand what happened in terms of their mental health. So it was a small open trial of 11 youth. They were on average 15, predominantly female sex at birth. They had various different kinds of LGBTQ identities, and they were about a quarter Hispanic, about a quarter Black, and 18% bi or multiracial. What we heard from this is that youth were using Flourish around twice per week, which is within the target that we had hoped for. They rated Flourish's helpfulness after a month of using it on a 1 to 5 scale, with 5 being the most helpful at about a 4. Those usability scores I showed you before stayed in the excellent range, and we had good retention of teens who started the study, stayed in the study, meaning that it was pretty good data quality. And this is showing you what happened with youth who used the intervention, so used Flourish. The baseline is when they very started using Flourish. Week 4 is 4 weeks after that, and week 12 is 12 weeks after that. And you can see those different colors there are the percent of youth who endorse different kinds of suicidal ideation, with across the board it really reducing over the study period. So 11 youth isn't that much to say anything scientifically, so we have additional studies going on within a larger group of youth and within a different study design that we should be able to say something more about the quality of the evidence after that. And we also are doing some work to move Flourish into schools. So we've adapted Flourish for use within schools and are currently rolling it out within 2 schools in Pennsylvania and Ohio. A couple quick conclusions and opportunity. So what we can say so far is that it seems like Flourish can be feasibly and acceptably used within LGBTQ youth, and that we really need more research to say more about, is it really effective? Is it clinically effective? And some of that I mentioned is currently ongoing. And so we are also interested in doing more in this space. So if you are from an organization that might be interested in working with us to reach LGBT with Flourish, you're welcome to reach out. It is currently only within the research space, but it is free and designed for LGBTQ plus suicide prevention. So my email's there. And lastly, I will talk about strategies and resources within this space. And I wanted to really frame this conversation into some priorities that we can think about for LGBTQ suicide prevention as it relates to the context of social media. So first, we can think about creating a safe space for discussing social media. So what we can see even from larger studies like a meta-analysis that has a higher quality of evidence is that for parents or for caregivers, engaging with teens in active discussion, open discussion, supportive discussion about social media is more effective than just restricting different aspects of social media than making a difference in actual risk-taking behavior online. So if we're doing things like, it's not to say that parental monitoring or restricting certain aspects of youth don't have a place. They do. But that it was the piece around open conversation that actually made a difference in young people's risk-taking behavior. And in terms of what those should look like, we would think about developmentally appropriate conversations with, younger teens really maybe needing some more education. With older teens, sometimes just they've learned a lot of lessons and looking for validation over the course of time. So things that are developmentally appropriate and appropriate for that child's individual risk level. A second priority is supporting adaptive coping after negative online experiences. So as I mentioned, stress can really increase after negative online experiences. So helping youth and walking with them to help them cope through that is going to be really important. A third is offering appropriate help and support. There are a number of different barriers that teens express and LGBTQ plus teens express in not reaching out for help around social media. There are things like trust, concerns around being outed, so privacy, getting in trouble, or feeling like a burden. And a big piece of this also, of that trust piece, is do I actually expect the person that I'm saying this to have some idea of what to do with it? Will they actually be helpful? And that really, I think, takes it to the last piece of this, which is really around education to support teens in navigating social media. So we have to know what the resources are that are out there. We have to know that we're able to help and to demonstrate that for teens to really have buy-in, that we're a person that would be good to go to. And so keeping up to date as possible with the different trends in social media and ways to support teens in creating positive online environments, but also very much so treating teens as experts in their own experience, having some humility to say, I don't know everything about this, but could you explain it to me? Can you explain what this means for you? And really kind of including those conversations and just kind of daily conversations of how was school today? How are things going on social media? Are there good things happening? Not so good things? I'm here to listen and to help. Incorporating that in just to how we're monitoring and checking in on a daily basis. In terms of other resources, I wanted to give a little bit more information on the Flourish website, which we have purposely made open to anyone. So if you go to that, you can check that out. There's a digital library of different coping skills, and you can see the different options, some of the different options that are in the menu there. So if you click on any of those, there's going to be 3, 4, or 5 different resources within that that you can connect to that gives concrete information about how to actually use those skills. These are all designed to really be helpful around stress around social media, but they're also, I think, things would be helpful around stress a little bit more broadly to that too. There's a section on stories that I mentioned before. These are based on the lived experience of teens who have experienced different aspects of online negativity and what they actually really did that was helpful in that moment. And so I'll give you an example. There's an example here from we have based these stories around a variety of different identities, which you can see on the left there. This is one from a trans identifying girl, Rosa. It's not a real name of a teen, but it was based on the real experience of experiencing a lot of bullying based on wearing girls' clothing, feeling like she just wants to disappear. And this is someone who is considering reaching out to the Trevor Project hotline for help. And the response is, someday you'll be able to transition to your liking, wear the clothes you enjoy, make friends who call you Rosa and she, her without a problem, and celebrate those transition steps with you. Right now, the world feels like it's crashing down. I get that, but the world is also very nice. There are parts of the world you can go to where you will be happy. You will be happy, Rosa. And that in particular was written by a writer based on the lived experience of teens who identified as trans and was thinking back to when I was a teen, what would have really been helpful for me if I was having suicidal thoughts, I was thinking about reaching out, what would be the difference in actually doing so? And that gives you some example of the stories that are there that are really meant to inspire hope and also inspire that interest in reaching out for help and the belief that it could be there. And there's also a lot of different resources for LGBTQ teens. There's general resources too on coping skills, mental health, social media, but we have some LGBTQ specific ones there. And this is these are the different categories of resources that are there. So they're around cultivating positive identity, connecting with other LGBTQ youth, advocacy and legal organizations, information on LGBTQ specific crisis hotlines, and also resources for parents of LGBTQ youth. I'll highlight some of the ones that I think are especially great. There's IMI, which is a website for LGBTQ youth. It's really curated to provide resources related to the topics you're seeing below, related to queer and gender diverse identities, to reduce stigma. There's pieces around there also around dealing with gender dysphoria, as an example. And it's built by the Hope Lab, meant to be really engaging, but also evidence-based information for supporting LGBTQ mental health. These are some LGBTQ specific crisis hotlines. So I mentioned the Trevor Project before, which is a great organization. There's also the Trans Lifeline. It's a peer hotline that is staffed by other people identifying as trans on the other end of the phone. And then there's Call Blackline. That is a peer support hotline that's specifically for Black and Brown youth and LGBTQ youth of color. There's some different peer support options, and these are both, I've heard from teens who had really positive experiences on them. There's the LGBT National Health Center. So they have moderated chat rooms, meaning that there would be some kind of adult moderation on them to make sure that there's appropriate conversations. They do have specific chats that are meant for teens and also for trans teens specifically. They have a confidential hotline that has one-on-one peer support as well. There's also Give Us the Floor, which is an organization that does a lot of training other youth to facilitate really confidential, anonymous support conversations. It's really looked at as youth only. They also offer peer support for youth, and it's not moderated, so I keep that in mind. So if someone who is thinking about resources for an LGBTQ young person, I probably wouldn't give a resource that didn't have moderation as a single resource. Maybe this is an opportunity to look for that kind of support or connection. We will look for other pieces around provider support in addition to that. Right to Be is a great resource for dealing with harassment of various different types, online harassment being part of that. It's really designed with youth in mind, which is, I think, a lot of the important work that is out there. And it has a lot of great resources for dealing with online harassment, if you've experienced it, helping if you have seen that happening to other people in your life, and also resources for parents and others. There's some great advocacy organizations on there. I mentioned the Pennsylvania Equity Project here, but there's some national ones there too, and they can direct to more local ones within your area. There's some legal organizations. So the ACLU has a lot of helpful information that we've resourced for thinking about issues around bullying in schools, in particular for LGBTQ youth. There's the Transgender Law Center, and there's also Lambda Legal, which is a legal organization specifically focused on LGBTQ individuals. There's resources for family members on supporting LGBTQ identity too. The Trevor Project has a great guide called Being an Ally that's specifically meant for caregivers or other people who are connected with LGBTQ young people. And there's an organization called Hugh Lane that's in the Pittsburgh area, but they have some programs that can be used nationally, one of which is called the Caregiver Affirm Program. It's based in cognitive behavioral therapy. It's a group program meant for caregivers of LGBTQ plus youth that really is talking about how, and openly with other caregivers, how can we be supportive and also be supportive among LGBT youth who have various different mental health concerns. It's offered virtually for 4 sessions, 2 hours each, and it's free. And because it is virtual, that's something that's open more broadly. And I checked, and they do have open registration currently through June, and the link for that is below. These are also just some resources I thought I'd mention related to social media in general. And so if you're interested in just learning about having some parent guides for different topics from social media to thinking about them getting the first phone at the same time and other related topics like the complexities of AI right now, Common Sense Media is a great organization. And for topics related to cyberbullying, the Cyberbullying Research Center has a lot of great resources that are really broken down for educators, healthcare providers, parents, students, etc. If there are any providers in the audience, these are a couple great training resources. So the National LGBTQIA Health Education Center has a library that has over 100 toolkits for LGBTQ Health Center, a lot of recommendations and information around culturally responsive care, trauma-informed treatment, and the the National SOGI Center also has a library of a lot of great information. They have resources specifically around safety planning, which is an evidence-based intervention for suicide prevention within this population, and some different information about how to assess and treat LGBTQ young people. So that ends what I had planned for today. My website is there, as well as the website for the intervention, as well as my email. If anyone has interest in this area, has other questions that you want to ask now, or you would rather just reach out outside of this, you're welcome to reach out to me and I'm happy to chat at any point.